Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Dr. Phyllis Yezzo, who is the Executive Vice President and Chief Nurse Executive at WMC Health, about the recent awards that the health system has received and how to achieve nursing excellence at the bedside. So, hi, Phyllis, how are you?
I'm very well, thank you.
Of course, yeah, and thanks for taking the time and congratulations on the two awards that WMC Health was recently given. And right off the top, I wanted to ask you, what are some of the factors that led to WMC Health winning the Prism and Beacon Awards?
I think the main factor to consider is nursing team consistency and standardization, delivering strong, measurable patient outcomes through thoughtful use of evidence-based practice. I think
Absolutely.
another, if I might add to that,
Yeah.
high staff engagement and close collaboration, not just amongst the nurses, but the entire interprofessional team, has actually helped us achieve those outcomes.
Absolutely, yeah, and they're both very prestigious awards to my understanding. So congratulations. So we're here to talk to you about nursing excellence at the bedside, which, as I think a lot of nurses are starting to leave the bedside, it's more important than ever. So what are some of the key proponents of a nursing strategy that leads to excellence at the bedside on med-surg units?
I think there's many factors, but I think one of the most important factor is creating an atmosphere with a mentoring environment where critical thinking is encouraged and supported, and really empowering the frontline staff to work at the top of their license. That builds the confidence and the clinical strength, and we provide that through a structured orientation, hands-on training, and ongoing support from our nursing professional development department. But more so, the nurses on these particular units have actually taken the initiative to mentor a more novice nurse and to bring them into the fold and truly incorporating them to be members of the healthcare team.
Absolutely. And I'm glad you mentioned mentorship. It's very important. So, what do you think are really the impacts of a strong mentor for a novice nurse, as you're saying? Because I think that could make or break a nurse early on in their career is having a strong mentor. So, what are your thoughts on that?
I think really embracing a novice nurse. We do hire a lot of new grads, and education today is not what education was in the past when I became a nurse eons ago.
Mhm.
And really, the more senior nurses, expert nurses, really taking them under their wing and showing them what needs to be done to provide compassionate, empathetic care um, in an inpatient setting. But it's more than just the tasks that are involved. It's understanding the reason why and knowing what you are doing, but why you are doing it and how it
Mhm.
would produce the best outcome for the patient.
Mhm.
And it's also
Absolutely.
it's I'm sorry, it's also um, developing the trust of your peers and working together.
Absolutely. Yeah, I could not agree more. So another thing that obviously is important in this equation is staffing models. So how do you ensure that your staffing models reflect patient acuity at the bedside and support nurses practicing at the top of their license?
Well, here at our flagship, Westchester Medical Center, we have really a very, very high acuity, and staffing is paramount. We focus a lot on retention to retain our nurses, but on an annual basis, prior to the next fiscal year, we actually collaborate with our frontline staff. We use the standards that are set forth from professional organizations as a framework to build upon and get their input as to what the needs are on that particular unit. Every unit is different. Um, it's 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 might not be the same on unit A as it is on unit B, and what is the uniqueness of that unit that would require more staff to care for the patients. And it's a dialogue, it's a discussion, it's a partnering to come into agreement on what are the staffing patterns that we really need to employ.
Mhm. Absolutely. And are you employing any sort of creative approaches to providing that uniqueness in staffing to each unit?
Well, we look at, the acuity, we look at the case mix index, we look at the average daily census. We look at the modalities of, what are the disease entities on that particular floor. We try our best to cohort patients because similar to physicians, a nurse is not a nurse is not a nurse, and you need to have the right nurse on the right unit at the right time to take care of the patient.
Mhm. Absolutely. And so I want to talk a little bit about empowering med-surg nurses at the bedside. As I mentioned earlier, I think there's some leaving of the bedside that's happening in the industry right now. So what are the benefits of really having empowered med-surg nurses, and how do they influence quality improvement, outcomes, and decision making?
Well, empowering your nurses really strengthens the morale of the unit and that sense of teamwork. Um, Nurses are really proud to be part of a winning team. And in many organizations, we truly don't promote ourselves.
Hmm.
So rewards such as the Beacon Award and the Prism Award really highlights the accomplishments of the nurses that are here caring for the patients.
Absolutely. And you mentioned this a little bit earlier with metrics, but what are some of the strongest and weakest nurse-sensitive outcomes that you use to measure the success of your bedside nursing strategy?
Well, we track all the nurse sensitive indicators. We use NDNQI, the National Database for Quality Improvement in Nursing, which is sponsored through ANA.
Mhm.
Um, and it's not only is it important to provide the care, but it's also to measure those outcomes. If you can't measure something, you can't manage it. So we keep a very close eye on the metrics to see how we're doing. And if we see that there is a deviation on any of the nurse sensitive indicators, which the usual nurse sensitive indicators nationwide, falls, collapses, pressure injuries, any adverse events, we really get on it right away. We foster the model for improvement using PDSA, plan, do, check, and act, to actually almost, stop the train in its tracks and then go back to the staff. And what are their ideas? The staff is at the bedside. They have the answers.
Mhm.
I don't have the answers. They have the answers. And it's
Mhm.
important to listen and to hear what their input is on how we can make a process or an outcome better and achieve those successful outcomes. Um, I'd like to mention something specifically about med-surg nurses, if I could go back to empowerment a little bit.
Mhm.
Specifically for the PRISM Award. The PRISM Award is an award from the Association of Medical Surgical Nurses. And we mentioned novice nurses earlier. Most nurses, when a person becomes a nurse, um, everybody wants to work in a specialty area. And nobody
Mhm.
really appreciates in the beginning of their career the credence and the importance of medical surgical nursing.
Mhm.
Through an episode of care, med-surg nursing is almost the most crucial part of a hospitalization because we're preparing the patients to go home.
Mhm.
We're preparing the patients to transition to a state of wellness. And it's those med-surg nurses who actually t- provide that education and that support to the patient so that they can live a full and productive lives once they are discharged from the hospital. I can't emphasize the importance of med-surg nurses enough. They are so pivotal in the continuum of care. I tip my hat to them. I truly, truly do.
Mhm. Absolutely. And to piggyback off of that, now that the health system has acquired these two awards, what's your strategy to continue that excellence at the bedside and to continue that empowerment of your med-surg nurses?
Well, we always encourage frontline staff as we said, to work to the top of their license. But I think one of the best strategies is being visible and listening, purposeful listening, and ensuring that the staff knows that they have been heard.
Hmm.
One of the great things about receiving an award on a few units is that it almost becomes contagious,
Hmm.
and other units replicate, and that learning and the learnings that are gleaned from those particular areas now becomes transferable.
Hmm.
If unit A can do it, why can't unit B?
Hmm.
And it permeates through the organization. I'm really proud of the nurses here. Um, I pride myself in my own nursing practice. I am a nurse's nurse. I'm out there, I'm visible, I'm listening, I'm talking to the staff, I'm hearing their input. And it's not just listening, it's getting back to the nurses should they have questions.
Hmm.
Not every idea is a great idea.
Yeah.
And there's no such, there really should be no such thing as a slow no. If someone has an idea that operational, of course we'll go ahead and use it. But if there's something that's like so out of the box that it's going to be virtually impossible, we need to get back to the nurses to tell them that that's really not possible to do at this point in time.
Absolutely. Yeah, that transparency and communication are definitely key, I think. So my last question for you, we've talked a lot about nurses today, but I want to ask you about other CNOs. Do you have any advice for other CNOs who want to improve their med-surg nursing strategy?
Well, we touched on that a little bit already, but I think visibility is the key point. Um, if you read the literature, you'll see senior leader rounding on employees, but it's not a check the box. It's really being visible. It's being there with your nurses. It's knowing who they are, not just as a nurse, but as a person.
Hmm.
And again, that active listening. Um, I don't have all the answers. I can come up with, all the solutions. I need the frontline. I need the frontline staff here as much as I hope that they need me
Hmm.
in this situation, because they're the ones providing the care. And I think a key component is trust,
Hmm.
and trust is a two-way street.
Hmm.
We need to trust our staff, and we need the staff to trust the leaders in the organization. Leadership is a team; it's not just one person. And again, it's a reciprocal relationship. We
Hmm.
need staff to feel safe in a safe environment so that they can bring up all the great things as well as the things that can be improved upon.
Hmm.
And again, take their ideas because they do have the answers. And developing a culture where people feel free to share their ideas,
Hmm.
and using a just culture when things happen. And really having the nurses have a voice. Nurses need to have a voice in their own practice.
Absolutely. Yeah, I cannot agree more. I've heard some of the other CNOs that I've spoken to really try to hammer that home that nurses should have a voice at the table and nurses should be leading other nurses and really making some of those big decisions. So I could not agree more. Um, well, I think that is a beautiful note to end on. Thank you so much, Phyllis, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights, and congratulations again on the awards. And thank you so much to our audience for listening. Thank you so much, Phyllis.
And thank you.